Welcome back, and I am joined this morning with Dr. Timothy Jochen from Contour Dermatology, and we're talking about a subject that gets to the heart of a lot of people, especially living in a community as we do, where it's you're out in the sunshine all the time and you are wanting to always look your best. We are in Southern California after all, but we're talking about scar treatment, especially for people that have acne or had acne. And I have to commend you. You've come in today and you have a little bit of a red mark under your eye. You have tested what we're going to talk about, and I find that, do you do that with all of your treatments? Do you try them out on yourself first to make sure that they're okay before you try them out on your patients?
I do. I'm addicted to the treatments that we have because I'm more worried about aging, but I also have some acne scars that I got when I was a kid.
You're kidding.
And so I'm always trying to minimize them.
See, I don't see them. I'm sitting right next to them, so this must work. So when we're talking about, though, acne scars, people are extremely self-conscious of it. I mean, my gosh, first of all, they had the acne and they lived with that, and now they have the scars. So how do they get rid of them?
Well, you know, first thing we want to do is we want to evaluate the color. So if the scars are red, because if you have scars, oftentimes they'll be red, we have a laser to get rid of the redness. If they're brown, we want to get rid of that brown. Because oftentimes the color, if you're looking at somebody from across the room, you can see a red spot or a dark spot. So evening out the skin tone is the first thing. And we have devices for the darker spots and also for reds. And then we want to evaluate, are they raised or are they depressed? And there are different treatments for both of them. And today the laser I'm demonstrating is one that'll help with the depressed scars, and it'll also help to even blend it in with the rest of the skin tone so you can't notice it.
Now, I asked you, does that hurt? Because to me, it looks like it hurts his eyes.
Well, you know, for me, you know, this doesn't hurt at all, actually. It's just a little bit pink. But I did it to show people how easy the lasers are, because, you know, some people think a laser is going to leave you red and purple and gooey.
We do have photos, so we can
Oh,
we
good,
can show
yeah,
people.
so we can take a look at those, too.
Are they there? I don't know whether you can see them, doctor, but they're showing the difference. Is that the before and after that we're looking at right there?
That's a before and after, yes. And I believe that one's just a dermabrasion. And that's a surgical scar that we did. And with the surgical scar, you know, initially it looks pretty ugly, but that's just after 6 weeks you can see how much improvement you have. Now we could also do lasers to help that redness fade away a little bit, and you won't even see this in a few more months.
That's amazing.
Yeah, we can really make scars disappear a lot of times.
So it's not just with acne, it's any kind of trauma.
Any kind of scars.
And it can be in any part of the body, I would assume, then, too. It doesn't have to be the face, but obviously that is where people are most
self-conscious, of course.
Correct.
But I have to tell you, the face is much easier to treat than the body scars. Now, here we have an acne scar, and what we did is we did a little laser treatment to help this disappear. Now, we also did a little subcision here to help lift up that depressed scar, and then we do laser treatments to smooth it out and blend it in with the rest of the tissue.
That is amazing. And, you know, doctor, I have to wrap things up here, but wow.
Again, a very dramatic scar, and over time, if you're persistent, you can really get rid of these scars.
That is great, and I guess the most important thing is to seek out a doctor and make sure it is a doctor such as you that has the experience. So we appreciate you coming in and showing us what can be done. You don't have to live with those scars anymore. We'll be right back, and Dr. Timothy Jochen, thank you so much, from Contour Dermatology. We'll be right back with more news.